Hello my dear students, welcome to my channel Nursing Mantra Official. Today we will solve important MCQ on fundamental of nursing which will help you in all kind of nursing exams, so let's get started.
Question number 1. Which of the following medication order is immediately and once only administered? Option A PRN order. Option B stat order. Option C single order. Option D standing order. Option B stat order is the right answer. Question number 2. What is the meaning of PRN in medication administration? Option A immediately. Option B alternate days. Option C every morning. Option D when required. The right answer is option D when required. Question number 3. The discoloration that appears in the dependent areas of the body after death is called. Option A stiff mortis. Option B rigor mortis. Option C livor mortis. Option D algor mortis. Option C livor mortis is the right answer. A dark blue staining of the dependent surface of a cadaver. Cadaver means a dead human body used for medical study, resulting from the pooling and congestion of blood called livor mortis or postmortem lividity. Now the question number 4. The type of autopsy that is done to determine cause of death for medical legal purposes is. Option A forensic. Option B clinical. Option C diagnosis. Option D research. Option A forensic is the right answer. Question number 5. What is the process of introducing a disinfectant solution to the internal environment of the body when passes away? Option A revaccination. Option B embalming. Option C rinsing. Option D embacterium. Option B embalming is the right answer. Preparing a body for burial by injecting Q preservative such as 4% formaldehyde solution within 48 hours of death called embalming. Question number 6. Wound made by surgical incision by a surgeon under aseptic condition is called as. Option A puncture wound. Option B clean wound. Option C contusion. Option D infected wound. Option B clean wound is the right answer. Now the question number 7. Surgical removal of infected or dead tissue from the wound is called. Option A debridement. Option B dehiscence. Option C debulking. Option D incision and drainage. Option A debridement is the right answer. Question number 8. For an operation OT nurse should prepare. Option A dressing trolley. Option B emergency trolley. Option C Mayo trolley. Option D washing trolley. Option C Mayo trolley is the right answer. Mayo trolley is basically used to carry medicines and medical instruments like syringe, scissors, knives, cotton, spirit, etc., which is used while performing an operation. Question number 9. Color coding for nitrous oxide cylinder is. Option A black with white shoulder. Option B black. Option C French blue, light blue, blue. Option D gray. Option C French blue, light blue, blue is the right answer. Question number 10. The guidelines recommended by the Center for Disease Control in 1987 which were updated in 1988 to prevent the transmission of AIDS are called. Option A hospital infection control. Option B personal protection. Option C central sterilization. Option D universal precautions. As we know, option D universal precautions is the right answer. Question number 11. In case of accident, what would you first examine? Option A hemorrhage. Option B fracture. Option C patent airway. Option D possible head injury. In case of accident or any kind of serious injury, we should have to assess and maintain airway of the casualty, so option C patent airway is the right answer. Question number 12. In lumbar, puncture needle must be inserted into Option A, subarachnoid space. Option B, bone. Option C, sinuses. Option D, posterior superior iliac spine. Option A, subarachnoid space is the right answer. A lumbar puncture, also known as spinal tap or spinal puncture, is the entry of needle into the subarachnoid space of meningeal sac below the end of the spinal cord. It is done to collect cerebrospinal fluid for diagnostic tests. Measure CSF pressure. Give drugs into the CSF or to relieve CSF pressure. Question number 13. Magnesium sulfate is known as Option A, Epsom salt. Option B, iodized salt. Option C, gypsum cement. Option D, black powder. Option A, Epsom salt is the right answer. Question number 14. As a precautionary measures, you will perform the following test before taking a sample for arterial blood gas analysis. Option A, Hohmann's test. Option B, Allen's test. Option C, Koop's test. Option D, Adson's test. Option B, Allen's test is the right answer. Question number 15. Eugenics means Option A, genetic counseling. Option B, improvement of genetic endowment. Option C, genetic preventive measures. Option D, improvement of environment. Option B, improvement of genetic endowment is the right answer. Question number 16. The cardinal signs of the body includes the following except Option A, blood pressure level. Option B, blood glucose level. Option C, temperature. Option D, heartbeat. Blood glucose level is not a cardinal sign, so option B is the right answer. Question number 17. Nurse should be alert for following complications after patient has undergone bronchoscopy. Option A, bronchitis. Option B, pneumonitis. Option C, hemoptysis. Option D, pneumothorax. Option D, pneumothorax is the right answer. Bronchoscopy means examination of bronchi through a bronchoscopy. Complications of bronchoscopy includes pneumothorax, which is most common complications, and others are bleeding from nose, shortness of breath, hypoxia during procedure, chest pain and cough, etc. Question number 18. Potassium content Ringer's lactate MEQ, L is Option A, 130 MEQ, L. Option B, 109 MEQ, L. Option C, 4 MEQ, L. Option D, 50 MEQ, L. Option C, 4 MEQ, L is the right answer. As we know, RL contains ions of sodium 130 MEQ, L potassium 4 MEQ, L calcium 2.7 MEQ, L chloride 109 MEQ, L and lactate 28 MEQ, L. Question number 19. The student prepares to administer buccal medication. The medication should be placed Option A, on the client's skin. Option B, between the client's cheeks and gums. Option C, under the client's tongue. Option D, on the client's conjunctiva. The right answer is Option B, between the client's cheeks and gums. Buccal medication are designed to be placed in the mouth and held between the cheek and gum until dissolved. It absorbed through buccal mucosa. Question number 20. A nurse assess the patient's respiratory status. Which of the following symptoms is an early indicator of hypoxia in an unconscious patient? Option A, restlessness. Option B, decreased respiration. Option C, cyanosis. Option D, apnea. Option A, restlessness is the right answer. Hope this strengthened your FON basics. Don't forget to like, share and comment. And please do subscribe the channel for more nursing insights. Thank you for watching. See you in the next video. Best of luck, my dear students. Bye.